You know, we spend billions of dollars a year on creams, serums, and treatments, all chasing that one thing: younger-looking skin. We're promised miracles in a bottle, but what if the real miracle wasn't in a bottle at all? What if it was already inside you? Today, we're diving deep into one of the most talked about, most futuristic, and maybe even most controversial topics in beauty: stem cell therapy for skin rejuvenation. Is this the real-life fountain of youth, or is it just expensive, overhyped science fiction? Let's break it down. First off, what even are stem cells? Forget all the complicated jargon. Think of them as your body's master cells, the ultimate blank slates. They have this incredible, almost magical ability to transform into any other type of cell your body needs. A skin cell, a muscle cell, you name it. They're your body's natural repair crew. Now, as we age, a few things happen. Our production of collagen and elastin, the proteins that keep our skin firm and bouncy, takes a nosedive. Plus, our existing stem cells get a little, lazy. They don't respond to damage as quickly as they used to. The result: wrinkles, sagging, and that dull, tired look we all dread. This is where stem cell therapy comes in, and it's pretty mind-blowing. The idea is to reintroduce a powerful, concentrated dose of these supercells and their growth factors back into your skin to basically kickstart a massive regeneration project. So how does it actually work? Well, there are a few different approaches, and this is where it gets interesting. One of the most common methods doesn't actually involve injecting live stem cells directly. Instead, it uses what are called stem cell conditioned media, or growth factors. Doctors will take stem cells, often from a donor source like umbilical cords or even from your own body, usually from fat tissue, and grow them in a lab. In this lab environment, these cells release a powerful cocktail of proteins, growth factors, and cytokines. It's like a supercharged nutrient broth for your skin. This broth is then purified and injected or microneedled into your face. It's not the cells themselves, but all the powerful signals they produce, telling your old skin cells to wake up, get to work, and start acting young again. Then there's the more direct approach: autologous stem cell therapy. Autologous is just a fancy word for from your own body. A doctor will perform a mini liposuction to harvest a small amount of your fat, which is rich in a type of adult stem cell called mesenchymal stem cells. This fat is then processed in a special machine to isolate and concentrate those stem cells, which are then immediately injected back into your face. The theory here is that these fresh, active stem cells will set up shop in your skin, differentiate into new collagen-producing cells, and coordinate a major repair and rejuvenation effort from the inside out. The promised results? We're talking improved skin texture and thickness, a reduction in fine lines and wrinkles, better hydration, and a more even skin tone. Some studies have even shown it can help with scarring. People who've had it done often describe their skin as looking healthier, stronger, and having a glow that they haven't seen in years. It's not an overnight fix. The magic happens over several months as your body builds that new collagen. Okay, that all sounds incredible. So, what's the catch? Well, there are a few big ones. First, and this is the elephant in the room: the cost. This is not your average facial. We're talking thousands, sometimes tens of thousands of dollars per treatment. It is a serious financial investment. Second, regulation is still a bit of a wild west. The FDA has approved some stem cell products, but there are tons of clinics out there making claims that aren't backed by rigorous science. It is absolutely crucial to do your homework. You need a board-certified dermatologist or plastic surgeon who is transparent about exactly what they are using, where the stem cells come from, and what realistic results you can expect. Don't be fooled by fancy marketing for a stem cell facial. That's just a regular facial with a serum that has some apple stem cell extract in it. That's not the same thing at all. And finally, while it's generally considered safe when done properly, especially when using your own cells, there are still risks, just like with any medical procedure: infection, inflammation, or simply not getting the results you paid for. So let's circle back to our big question: is it worth it? The answer is, it depends. If you have the financial means and you've exhausted other proven treatments like retinoids, lasers, and fillers without getting the results you want, then stem cell therapy could be a revolutionary next step. The future of skincare isn't just on the surface, it's cellular. And that's a pretty exciting thought.